toxic, especially with premature newborns. And then this blended oxygen is then humidified to prevent any damage to the nasal passages and airways. So the baby therefore breathes in a mix of ambient air and oxygen through either nasal prongs or a nasal mask. And then at the end of the system, the exhaled air travels through the tube that's placed in a container of water. So then as the air escapes through the tube and into the water, it creates these bubbles. So these bubbles push back slightly against the airflow, and this back pressure travels back up through the system and into the baby's lungs. So even after the baby breathes out. So it's like there's a cushion that's keeping the lungs from collapsing and therefore keeping the airways open and making every next breath of the baby easier and easier. So the bubbles make this pressure keeps the lungs open, and that helps the baby breathe better. So here are some effects of bubble CPAP on basic physiology of the lungs, and I'm just going to walk you through what it does for the lungs in some simple terms. So increased transpulmonary pressure. So basically bubble CPAP gently pushes air into the lungs, and this helps keep the airways open, making it easier for the lungs to do their job. Increased functional residual capacity, or FRC. So even after a breath is exhaled, bubble CPAP helps keep a little air inside the lungs, and the leftover air makes the next breath easier and prevents any lung collapse. Improved alveolar recruitment. So like I showed you in the picture before, alveoli are these tiny sacs in the lungs, and some of them can be closed off, especially if you have a sick or a premature baby. So bubble CPAP helps open these sacs so that more of the lungs can take in oxygen. There are other effects such as decreased intrapulmonary shunt, improved lung compliance, conserved surfactant. So surfactant, as you know, is a natural substance that helps keep the lungs from collapsing. And bubble CPAP is shown to preserve surfactant and even to create this important fluid. And it's been shown to decrease the need to give surfactant to newborns. It can also lead to a prevention of pharyngeal wall collapse, so it keeps this part of the airway open so that air can move in and out freely. Increased airway diameter, so again, pressure from bubble CPAP helps widen the airways, and this helps air flow more easily through the lungs. Chest wall stabilization, and bubble CPAP has been shown to promote the growth of immature lungs. So it gives immature lungs the time and the support that they need to grow and to develop. So in short, bubble CPAP isn't just about pushing air in, it's more so about protecting the lungs, supporting them, and helping fragile lungs develop and thrive. So here you can see some indications for bubble CPAP in newborns. So this mainly includes respiratory distress syndrome of prematurity, which I'll be talking about later on in the presentation, apnea of prematurity, meconium aspiration syndrome, transient tachypnea of the newborn, pneumonia, perinatal asphyxia. It can also be used as a post-extubation respiratory support. Also, and I'll talk about this more later on, recent WHO guidelines recommend the early, immediate use of bubble CPAP in very neonates that are less than 32 weeks of gestational age, because this age group has a high risk of developing respiratory distress, so they recommend giving CPAP prophylactically. Likewise, bubble CPAP can be used prophylactically in very low birth weight neonates, and that usually, the weight threshold usually depends on local guidelines. Bubble CPAP is not only used with newborns, it can be used in older infants, and this is usually in cases like pneumonia, bronchiolitis, and in some cases, congestive heart disease. So I'm going to show you some videos. This is a case of a newborn that has apnea of prematurity. So in this video, you can see very low oxygen saturation, and you can see that the baby is not being able to breathe. Now this baby, the same baby, is now on a Vayu bubble CPAP system, now breathing comfortably and now saturating well. So you can see the effect of bubble CPAP on apnea of prematurity. Now, there are some instances where you have to compare the potential benefits of using bubble CPAP therapy to the risks it might pose, because in some cases, the risks may outweigh the benefits, or in some cases, CPAP might just be less effective. So, for example, if there's active bleeding from the nose or cleft palate, choanal atresia, if there's an issue with the lower airway, like tracheoesophageal atresia or pneumothorax, or if there's any issue at the abdominal level, like persistent vomiting or congenital conditions like diaphragmatic hernia or gastroschisis. So these are cases where there may be airway obstruction that requires invasive ventilation, so for example, edema, or where increasing intrathoracic pressure might actually be, for example, with pneumothorax. And in other cases, like I mentioned, for example, isolated cleft palate, CPAP might be less effective because we're not being able to deliver the proper and appropriate pressure to the patient. So now I'm going to move on to the importance of bubble CPAP in the management of respiratory distress syndrome. So over here, you can see the case of a newborn with RDS, or respiratory distress syndrome. So you can exhibit some signs of respiratory distress. I don't think the volume is working, but this baby is exhibiting signs of grunting. You can also see some breathing and some. Now, this same baby has been placed on the Vayu Cpap system, and you can see that the baby is now breathing comfortably. There is no more retractions. The baby isn't grunting anymore. So again, you can see the benefit of bubble CPAP when it comes to respiratory distress syndrome. And in 2022, the WHO, the World Health Organization, put out recommendations for the care of preterm or low birth weight infants. And they strongly recommended the use of CPAP in preterm infants with signs of respiratory distress syndrome. And I want to also note that they highlighted the importance of using skilled staff, quality equipment, and quality consumables as well, which is something I'll talk about later on as well. They also recommended the use, like I mentioned, of immediate CPAP for infants born at less than 32 weeks of gestational age. Again, because they're at higher risk of having immature lungs, so it's best to give them CPAP prophylactically. And finally, they recommended bubble CPAP as a form of CPAP, again, keeping in mind the importance of skilled nursing care and the careful selection, maintenance, and monitoring of the devices, which is really important. Now, when you want to talk about respiratory distress syndrome, it's really important to look at their cases holistically. So on the left side over here, you'll see several parameters to assess in a neonate with respiratory distress. And on the right side over here, you'll find the corresponding actions. So starting with the first row here, you see work of breathing, which is what we saw in the previous baby in the video. So it's really important to assess their work of breathing. Are they grunting? Do they have retractions? And the action is to ventilate. Now, ventilation can refer to non-invasive ventilation like bubble CPAP or invasive forms of ventilation like mechanical ventilation. And the choice should be made based on the degree of respiratory distress and other factors. Ultimately, it is up to clinical judgment and local guidelines. Next, you can see oxygen saturation. So oxygen saturation obtained with pulse oximetry should be kept within certain bounds. So delivering blended oxygen is a very important way to ensure that the baby receives an appropriate amount of oxygen. You want to prevent hypoxia, but at the same time, you want to prevent hyperoxia because too much oxygen can be damaging to the baby, especially premature ones. Next, you have temperature. So babies have limited thermoregulation abilities, especially preterm neonates, and they're more likely to become hypothermic. It's very important to keep in mind warming methods such as kangaroo care. Next, it's important to assess heart and respiratory rates and monitor them closely. Another thing is if you're able to assess glucose levels, and if they're hypoglycemic, give them glucose. And it depends based on the level of their hypoglycemia if you want to go for oral feeds, oral glucose, or IV glucose. And finally, it's always important to assess the sepsis risk of your newborns, and accordingly, it may be necessary to take blood cultures or give them antibiotics. And over here, I just wanted to show you these two types of respiratory distress scores. One of them is called Silberman-Anderson, and the other is the modified Downs scores. It's up to your personal preference or what your institution uses, but they show some signs of respiratory distress and how to score it. For example, chest movements, retractions, nasal flaring, grunting. And there are other things to keep in mind as well, of course, giving IV fluids, caffeine, surfactant, mechanical ventilation versus CPAP, depending on what they need, blood transfusions, and always keeping in mind the best clinical practices like giving antenatal steroids, delayed cord clamping, kangaroo care, which is really important in not just thermoregulation and preventing apnea, but it's also been shown to help with their breathing. It's been shown to improve their neurodevelopmental outcomes, and of course, early breastfeeding. So now I'm going to talk about the CPAP system in particular. So this is a picture of the Vayu CPAP system. It provides flow, blended oxygen, pressure, and humidification. The humidification is to prevent any drying out of the nasal pathways. So the Vayu CPAP system is a linear system, which means the gases flow in a single direction. I'm going to play this video here. So they flow from the oxygen source through the blender, the filter, it gets humidified, and then out to the patient, and then it goes out through the pressure generator. So it's one linear system. And it's also a closed system because it fully occludes the nares. So this is very important to keep in mind. Once the nasal prongs are placed in the patient's nares, the patient becomes fully dependent on the system and will receive all their breathing gases from the device. And this is the Vayu blender. So this blender is the reason that the Vayu CPAP system works without electricity and without medical compressed air. So it's the most innovative part of the device. And on the left side, you can see that there is a blender nozzle, and this is where you connect the oxygen tube. And you can see an oxygen scale at the bottom. And this indicates that this blender can blend oxygen and ambient air to concentrations between 30 and 100%. So you can see from the indicator over here that right now the blender is set to 40%, which means you're giving your patient 40% oxygen concentration. And now I'm going to show you how the Vayu blender works. So you have a lock nut that you unlock, and you can screw or unscrew the blender to reach your desired concentration. And you can use the scale and the indicator to read what oxygen concentration you are giving your patient. Now let's open up the blender and see what happens inside. So here you can see blue particles. These represent pure oxygen coming in from the oxygen source. And they're in at a very high velocity. And this high velocity creates a low pressure because of the Venturi effect. I'm going to repeat the video. So it creates a low pressure because of the Venturi effect. This low pressure is able to draw in ambient air from the outside through these holes that you can see in the blender. And these are represented by the yellow particles. So essentially, you're mixing pure oxygen with ambient air, which, as you know, has 21% oxygen. So you're mixing all of these particles to make sure that you're giving the patient lower oxygen concentration and not 100% oxygen concentration. And you can see that this gap in the blender, this determines how much oxygen you're giving the baby. So the wider the gap, the more ambient air you're pulling in from outside, the lower the concentration of oxygen you're giving the baby. The shorter the gap, the less ambient air you're pulling in, the higher the concentration of oxygen you're giving the baby. So this means that you're able to titrate the concentration of oxygen that you want to give your patient. And one important point to remember is that there has to be continuous bubbling for you to know that the system is functioning correctly, because as I mentioned, it's these bubbles in the pressure generator that go back into the patient's lungs and help keep everything open and help prevent them from collapsing. So this is a video of continuous bubbling that you can see when the Vayu CPAP system is working correctly. So now I want to talk about what makes the Vayu CPAP system unique and useful. So other than the fact that you have this blender with the Venturi effect that can help us use the Vayu CPAP system without electricity and without the need for medical compressed air, there are other use cases that we've seen. One of them is that bubble CPAP isn't just used for neonates, it can be used for infants and young children. Another use case is that it can be used for transport. This is because the Vayu CPAP system is portable and it can function without electricity, like I mentioned. So it can be used for intra-facility transport between units and inter-facility transport between hospitals and facilities. So on the left over here, you can see the picture of a neonate on the Vayu CPAP system in an ambulance in the Philippines. And on the right, you can see a picture of a newborn being transported on a boat ambulance while being treated with the Vayu CPAP system. And this is in the Amazon region of Brazil. Another use case, and this is something I mentioned earlier, is kangaroo mother care. Kangaroo care is really, really important. It involves skin-to-skin contact between a newborn and their caregiver. And WHO very strongly recommends initiating kangaroo care as early as possible because it's been shown, like I said, to improve temperature regulation, so preventing hypothermia. It improves respiration. It improves oxygen saturation, vital sign stability, and weight gain. And it also has been shown to reduce any infection rates and neonatal mortality in babies who are put on kangaroo care. So newborns can benefit from kangaroo care while being treated with a Vayu CPAP system. And you can see it in this picture over here, which was taken in Ethiopia. So you see a caregiver holding the baby, and the baby is on Vayu CPAP. Our device has also been increasingly used in labor and delivery and in the maternal theater or operating rooms to provide bubble CPAP treatment as early as possible. Like I mentioned, there is a WHO guideline mentioning that for very premature infants, it's good to start them as early as possible right after they're born. And it's good to start them on the Vayu CPAP system because then the newborn can be transported with the Vayu CPAP system to the newborn unit without interrupting any treatment. So you can transfer them from the delivery room to the NICU while on CPAP the entire time. And this is a picture of a newborn who was started on early bubble CPAP therapy in the labor and delivery ward. Another thing that makes the Vayu CPAP system very useful is that it's very easy to reprocess, and you can reprocess it using very common disinfection solutions such as chlorine solutions. Another unique and very important aspect of the Vayu CPAP system is that it's part of this larger ecosystem called Breathing for Babies. It includes the devices, but it also includes research, mentorship, and training. All of these designed to help support healthcare workers and healthcare providers who are dedicated to improving the lives of these newborns and children that need respiratory care. So this involves training. So successful implementation and use of these devices cannot be achieved without proper and adequate training. So training is very, very important. And I'd like to remind you of the WHO guidelines I showed you before that highlight the importance of skilled nurses, good monitoring techniques, and this is where the training comes in to help with that. So the Vayu team and Breathing for Babies offer live virtual trainings, live in-person trainings, as well as an online training course, and I'll show you a QR code for the online training course at the end of the presentation in case anyone is interested. Another important aspect is mentorship. So it's really important that we provide mentorship. If anyone has a question, problem, or query, they can contact any local trainers. And if their local trainers have any issues, they can come back to the technical support team at Vayu Global Health, and we offer any support that is needed. And finally, Vayu is evidence-based medicine and has been very actively involved in a growing number of studies in countries like India, Tanzania, the Philippines, Brazil. So many of these papers have already been published in peer-reviewed journals. And I'm going to walk you through some of these papers right now. So I just wanted to point out that the Vayu CPAP system isn't just a device. It comes with this package of training and evidence-based medicine. So now let's go through the clinical evidence that has been published or has been presented about the Vayu CPAP system. So like I mentioned, there is clinical evidence present across several different countries. So in Tanzania, it was found that the implementation of the Vayu CPAP system was feasible, and healthcare workers perceived the Vayu CPAP systems as essential because of their simplicity, ease of assembly and use, minimal need for resources. Another thing that they found was that the quick application, around less than 5 minutes, was seen as very critical to improve patient outcomes. Clinicians also observed improvements in respiratory distress severity, reduce treatment duration. And because the devices are lightweight and portable, it helped enable their use and transport across different hospital areas. They also highlighted the importance of training, the need for training, like I mentioned. And there was a study involving 76 infants in Tanzania that demonstrated immediate and sustained improvements in physiological parameters, such as heart rate, respiratory rate, and the Silverman-Anderson score that I showed you earlier, while also significantly reducing the delivered FiO2, again, to avoid giving the baby too much oxygen. So this highlighted the potential of a viable CPAP system to provide safe and effective respiratory support in places where oxygen titration is usually limited. Now, a qualitative study conducted in Bangladesh revealed again that the viable CPAP devices are lightweight, they're easily movable, they're cost-effective. Healthcare workers found them user-friendly, they found the training easy, and they also highlighted the benefit during referral transportation. And the viable CPAP system was perceived as effective for the management of respiratory distress syndrome, leading to reduced hospital stays and decreased referrals. And there was no perceived difference in outcome comparing viable CPAP system to commercial bubble CPAP devices. Now, a feasibility study was done in Belgium in a neonatal medium care unit, and it found again that the viable CPAP system is easy to use. It resulted in high staff satisfaction and less hesitancy among the medical professionals to start CPAP for their neonates. Several studies have been conducted in the Philippines, and the introduction of the viable CPAP system was associated with a significantly increased survival to discharge, so an increase by 53%, and reductions in intubation by 48%, and reductions in surfactant use by 40%. A randomized control trial specifically investigated the use of processed viable CPAP systems, and they found no significant increase in neonatal sepsis rates compared to single-use mechanical ventilator-driven CPAP devices, which kind of also reassures us that even with the reprocessing and reuse of these devices, there was no increased risk of sepsis for the neonates. Other countries include India and Brazil. So in India, an early version of the viable CPAP system was implemented, and a study on this showed significant reductions in respiratory severity scores and rates among treated newborns, and there was a high survival rate to discharge of 83.7%, with no severe adverse events or deaths attributed to the device. Now, there are two studies that were conducted in Mysore, India, one of them in the PICU of a hospital and one of them in a NICU of the same hospital. And both studies were prospective designs. And they both found that the device was easy to use, it was portable, it was easy to integrate into the already present oxygen sources in the hospital. There were some challenges such as staff shortages, lack of time management, and infrastructure gaps. So for example, they didn't have warmers, they didn't have patient monitors, but overall the integration of the viable CPAP system was shown to be feasible and beneficial in both settings, and it led to improved patient outcomes. So for example, there was a discharge rate of 66% in the NICU and 88% in the PICU. And another study also conducted in the same hospital in the PICU compared the viable CPAP system to high-flow nasal cannula in a sample of 133 infants, and found that there was a significant decrease in all-cause mortality and a decrease in the need to escalate to mechanical ventilation in patients treated with a viable CPAP system as compared to high-flow nasal cannula. Now, in Brazil, there was a study that looked at the safety and effectiveness of viable CPAP systems for newborns with respiratory distress in the delivery room, and they're continued during transport to the NICU, like I mentioned. And again, it found that the devices led to very rapid and very significant improvements in respiratory conditions. So they saw a decreased Silverman-Anderson score, again, demonstrating how simple, mobile, and low cost the viable CPAP is for easy implementation in different facilities. So this is the end of my presentation. Thank you very much for listening and following along. I'm very happy to take any questions you have. if anyone is interested in asking more or finding out more, you can feel free to email either of these two emails. So info@vayughi.com is the general email for information from Vayu, and this is my email at Vayu, jadnan@vayughi.com. And I've also attached the QR code and link to our online training course if anyone is interested in taking the full training course. And you can also keep an eye out on our website because we will be updating some new training materials later on in the future. Thank you.
Yeah, thank you very much, Jana, for that wonderful and concise presentation. Again, many thanks to participants from all over the 36 states of Nigeria for finding time from their very busy schedule to make it to this training. We understand that today is Saturday and we all are supposed to be resting, but however, we took our time to be a part of this training. Thank you so much. I can already see a lot of hands up. Before I start taking the questions, I'd like to remind our participants that Fatra Medical Equipment Services is the host of today's training, and we are the country representative of Vayu Global Health, the manufacturer of the bubble CPAP device that we are talking about today. So we are also available for your local trainings, for on-site trainings. If you want any of these trainings, you can reach out to us. I have dropped one of our contact numbers on the chat, so you can contact us via that number. If you also want this Vayu CPAP device, we have them up for sale, as well as other accessories and other accompanied devices. So we will start taking questions now. Of course, the chat box is still on. If you have questions, you can drop them there. We'll do our very best to also reply you via chat. In no particular order, I'd like us to unmute our microphone and ask our questions, and we'll do best to give you the best answers possible. Thank you.
Good day, everyone. Thank you, Jenna, for the wonderful presentation. Yeah, in your experience, what is the most common mistake to avoid when setting up a bubble CPAP in newborns?
That's a really good question. Are these questions, just to clarify, are they for me or are they for people in Fatra? I can answer the question.
Yes, for you.
Yeah, some common mistakes that we try to avoid in our trainings are, so I mentioned before that the Vayu Bubble CPAP system is a closed system, so the nares are fully occluded, the prongs are fully occluding the nares. So it's really important to make sure that the system is always bubbling. You don't want to have the prongs in the nares of the baby and have the system not functioning or the flow not existing, because that would mean that the baby is not getting any oxygen or any pressure. So it's really important to keep this in mind, that you always want to have continuous bubbling in your system. There are other things to keep in mind, so such as like the connections, what components go where. The nice thing about the device is that it's a bit color-coded and there are labels, so it's a bit easy to do, but it's always important to keep in mind to make sure that you do the connections properly so that you don't accidentally harm the baby in the process.
All right, thank you very much, Jana. I'd like to add to that quickly. Once again, my name is Idris, and I am a sales and technical representative from Fatra Medical, the organizers of today's webinar. We are also the country representative for Vayu. So just to add to what Jana has said about the common mistakes in setting up the bubble CPAP device, as a distributor, some of the questions that we have gotten, is usually around this. Sometimes we get calls from customers saying that, oh, the device is not working. And most of the time we see that the fault comes from the oxygen source. So if your oxygen source is not optimal, we are going to run into challenges whereby you would not even have pressure that is sufficient enough to drive the entire system. So it starts from getting your connection right from the oxygen source. So in this case, it could be your cylinder, or it could be your oxygen concentrator, or whatever is available. Now, talking about oxygen concentrator, I want to shed some light on this. We understand that the concentration level of oxygen in our concentrators will naturally diminish over time. So I give you an instance. If you have your oxygen concentrator that you just bought brand new, there's a high possibility that the oxygen purity level might be about, let's say, 98%. But after a year or two of usage, you are no longer guaranteed your FiO2 on your oxygen blender, because if you do not have 100% coming in and you are adjusting your FiO2 wrongly, you might have a situation where your oxygen and air mixture is over diluted, and that can affect the saturation level on your patient. And just like Jana has said already, getting the nasal prong sizing right is very important, because for CPAP to be effective, we should have about 80% of the nest completely sealed. So getting your nasal prong sizing right is absolutely important. That's why the device comes with different sizes of nasal prongs to suit different patients that comes into the NICU. Then also, positioning of your patient is extremely important. There are some times that you position your patient in such a way that the airway is obstructed. If that happens, you're just going to have a situation where gases are not really able to get into the lungs, and that can be a challenge. So in summary, I would say, get your connection right, your oxygen connection right, get your nasal sizing prong sizing right, and of course, endeavor to position your patient correctly. Thank you very much. So if we have more questions, please go ahead, ask your questions.
Thank you very much. Good afternoon.
Good afternoon, sir.
Yes, good afternoon. Thank you very much for this session. It's been very informative, and we are happy that we have a Vayu Cpap in our practice. It has made the application of a CPAP quite, easier for us as compared to what we used to practice. So, with that said, there are two things I would like you to just like give us more information about. First is this CPAP system. It's not about value alone, or even the previous kinds of CPAP that we had. Is a closed system, and the baby in question will be generating carbon dioxide. So how does the system get rid of the carbon dioxide? That's one. Then two is the fact what you Dr. Jana was talking about the indications for the use of a CPAP. She mentioned apnea of maturity. It's a question that has been overflowed really, but I would just like to know in what circumstances, because we also know that apnea generally is a contradiction to use of CPAP. It's the respiration that drives it. But are there circumstances or instances where, okay, the application of CPAP will not be a treatment for apnea of prematurity? Then the last question is that while one knows that improvement in respiration is a signal to the gradual withdrawal of a CPAP in the baby. But in instances where you can even give it prophylactically, especially for babies less than 32 weeks. So what should we look for? And I would just like you to just go over the process of gradual withdrawal of CPAP. Thank you very much.
Thank you for your questions. I may have to ask you to repeat some of them, but I can start with answering the question about the apnea of prematurity. So, of course, the first-line treatment for apnea of prematurity is, if it's available, caffeine or something, a similar alternative like theophylline or aminophylline. And usually, like apnea of prematurity, it comes in waves of apnea and breathing, apnea and breathing. So it's usually you can wait for the apneic episode to end and then start them on CPAP, and in general, it will help improve their situation. But you're right, CPAP isn't the first line treatment for it, but it does help. It has been shown to help in cases with patients with apnea of prematurity. Can you remind me what the other two questions were?
Thank you very much for
Yes, the
your
second question.
yes.
Mhm.
Yes.
Should I go ahead?
Yes, please go ahead.
All right. So I asked a question about how the system gets rid of a carbon dioxide, the bubble CPAP being a closed system. So the baby generates carbon dioxide. So how does the system get rid, like to make it escape
That's a
this
great
carbon?
question. That's a great question. So I'm not sure if you remember the picture of the CPAP device. So the pressure generator jar, which had a green lid, and that's where the bubbles generate. They have a bit of holes at the top, and that's where the air escapes the system. So that's where the carbon dioxide goes out. So the carbon dioxide isn't stuck in the system. It goes out at the end because it's a linear system.
All right. Thank you very much. So the last question was about the process of a gradual withdrawal of CPAP. Like, okay, a child needs it, we have given it, and the child is getting better. What are the things we look at for to signal that the baby no longer needed CPAP? And is there a method to, gradual withdrawal? That's the question. Thank you.
Thank you for that question. So most of the time, like we like to say, to just refer to your local guidelines if you have any, or your institution guidelines, because I think different physicians like to do different things. I've seen there are some physicians that like to keep their patients on CPAP for as long as possible because CPAP helps with lung development. So they just keep them on CPAP for as long as possible, maybe decreasing the oxygen concentration and slowly decreasing the pressure. There are other physicians who like to immediately, like once there is improvement, start weaning them off of CPAP. So it really depends on clinical judgment and if there are any protocols, any local guidelines.
Thank you.
Thank you.
All right, thank you very much.
Great.
Yeah, just to add to the winning process. So for the trainings that we do for facilities, even the ones that are yet to buy, the winning up process is quite simple, and essentially it is about the escalation of your set parameters on the CPAP device. Essentially, when the CPAP is in use, we know that we set a certain FiO2 for the patient to breathe, and then we also set a certain level of PEP, that is a positive end expiratory pressure, which is in the bubble pressure generator. So what we do during our trainings is to tell the clinicians to reduce these parameters, between, let's say, 4 to 6 hour duration. So what I mean is, if a patient was at FiO2 of, let's say, 50, for example, they could de-escalate to 45, to an FiO2 of 45 on the blender, and then watch the patient for the next 4 to 6 hours to be sure that the patient is stable. So as they are reducing the FiO2 adjustment on the blender, they also de-escalate the PEP, until they get to 1, and after which they can remove patient completely. But what is most important while de-escalating is to monitor closely with your patient monitor to be sure that patient is stable before you de-escalate further. Thank you.
Thank you.
So more questions, please.
Hello, good evening. Yeah, good evening, ma'am.
Good evening. Please go ahead.
Okay, so I somebody has a question about giving CPAP due to indication of apnea of prematurity. So, and then but I noticed that in our facility there is some bit of hesitation. Why? Because sometimes when we give CPAP, like they commence for babies less than 33, 34 weeks. Now we realize that it prones them to apnea. Like we might just be suspecting that this baby might have apnea, but we're trying to prevent. But once we commence CPAP, I don't know, maybe it's the way we are doing it, or I don't really know. So I'm really confused. It has really been giving some kind of resistance among staff to commence CPAP sometimes, that it will now lead to the baby not having apnea. So, and also that we might also notice some decreased respiration in the baby sometimes, if after we've commenced CPAP, and then when we remove, like there's some discomfort. I'm really trying to like understand the whole process. Maybe there's some kind of problem with the way we give, or maybe it shouldn't be given when you suspect the patient having apnea of prematurity. I really want to get get clarifications on that. Thank you.
Thank you for your comment. And please, any other doctors or physicians who have, or nurses who have any experience with these, please feel free to weigh in. I think the answer I can give you is that if you're properly applying the device, you're making sure there's continuous bubbling, you're making sure that the baby is appropriately receiving the pressure and the flow of the oxygen, and they're not improving, then it might be an indication that you need to escalate your care, either increase the pressure or the FiO2 you're giving the baby, or even use like a higher modality of respiratory support, higher than CPAP, depending on what you have in your facility.
So does that answer your question, or you'd like us to shed more light on it?
Please shed more light. Thank you.
Does anyone have any insights on this from their clinical practice?
Please, if anyone have any insight based on their clinical practice, we are more than happy to have you share with us. But again, what I'd like to bring out is that for a patient to be qualified for CPAP, we have to get it clear that the patient needs to have some spontaneous respiration, before you connect to CPAP. So if there is no spontaneous respiration, it is important that you resuscitate, or you do whatever you need to do to, return patient to breathing spontaneously before commencement of CPAP. That is super, super important. Thank you. So I can see a hand up. Dupe, your hand have been up.
Okay. Good evening.
Good
Good
okay.
one. Thank you for the
Good evening.
Thank you for the good presentation. I was in one of your seminar sometimes ago, and the pressure generator, I think we're supposed to add a
Dupe, are you still there?
So in the absence of vinegar, what can we use? Or can we just use plain water or sterile water and not necessarily adding vinegar? Thank you.
Jenna, did you get that question?
No, can you please repeat your question? I'm sorry.
Please
There was
repeat
a
your
bit of
question.
noise in the background. Yeah.
Okay, I said I was in one of your seminar sometimes ago on the Vayu Cpap, that in the worker in the pressure generator, I learned we're supposed to add vinegar, of vinegar. And with the look of things in most of our hospitals, who will be responsible in getting the vinegar? sometimes you may have the Vayu Cpap. If you don't have vinegar, what else can we use? Or we can just use our sterile water or distilled water.
Yeah. So for your pressure generator, you can just use clean water. It's important to use sterile water in the humidifier jar, but in the pressure generator, you can use clean water. It's okay if you don't have vinegar. It's something we recommend, we suggest. But if it's really hard to acquire, it's okay. You can still use the viable CPAP without it.
Okay.
Thank you.
All right, thank you very much. I can see a hand up from let's see, Sowe Yankuba. Please, can you go ahead?
Good evening, wherever you are. Yes, I think my question was partially answered, and that is in relation to when can the CPAP be used, which someone made a comment on that sources of data have to be established first. That is why I was asking whether we can put a baby on CPAP if they are in severe respiratory distress, like chest and drawing. And I think that was answered. The second one was actually about, the water that should also be put into the one of the chambers. So should that water be also warm or should it just be normal water? And also, should it be distilled water or just normal water? So I really want a clarification on that. Thank you.
Thank you for your question. We don't have recommendations for the temperature of the water, but the humidifier jar, that's where the oxygen or the air gets humidified and goes to the baby. So it's important for the water in the humidifier jar to be sterile. As for the pressure generator jar, it's at the end, and that's where the air goes away. The baby isn't breathing that air. So it's okay for the water in the pressure generator jar to be just clean water. It doesn't have to be sterile water. But it's very important to make sure that the water is sterile in the humidifier jar because it's that humidified air is what the baby is inhaling.
All right, thank you very much, Jana. It's important that I also chip this in at this time. We have actually gotten reports where owners of Vayu Cpap device will reach out to us to say, in the attempt of adding some warmth to the gases being delivered to patients, so they resort to pouring hot water in the humidifier jar and as well as the bubble pressure generator, but most of the time the humidifier jar. So the jar itself is not designed to withstand high temperature. So if you pour in boiling water, there is a high possibility of damage. So what we recommend if you wish to elevate the temperature of the gases going into the airway of the patient is for you to put a large percent of the tubes, the breathing tubes into an incubator. So the warm air in the incubator interacts with the tubing, and by so doing, you can have some amount of elevated temperature in the breathing tubes being delivered to patients. Same also applies to if you have the patient under a radiant warmer. So do well to put a large part of the breathing tube under the heat source from the radiant warmer, and there's a high chance that the tubes are going to get heated up and the air going to the patient will also get warmed a little bit as well. But we really advise against pouring boiling water into your humidifier jar because from experience we've actually gotten not so nice feedback from users complaining about the humidifier jar getting destroyed due to high temperature. Thank you so much. Julie, your hand is up. Please go ahead with your question. Julie, are you there? Are you there? Fatima, can you go ahead, please?
Thank you for the presentation. In my facility, patients, babies like in SCBU, babies with preterm, stable preterm without any respiratory distress, we don't use this thing. We don't use CPAP for them. And in the process of presentation, it's like I heard you saying that we can use CPAP as prophylaxis. And how can we do that?
Great question. So the World Health Organization recommendations are for babies that were born at less than 32 weeks of gestational age, but other facilities I know like can do it less than 34 weeks or just prematurity in general. But as soon as the baby is born in the labor and delivery ward, as you're making sure that the baby has good vitals, doesn't need any like immediate resuscitation or anything, you can just get them started on bubble CPAP.
We
And
can get the baby on bubble CPAP as
yeah,
prophylaxis so that the baby will not go into respiratory distress. Is that so?
yeah, yeah. So
Okay,
like
thank you.
if that at a very low gestational age, even if they're not in respiratory distress, you can start them on bubble CPAP because bubble CPAP has been shown to kind of help the lungs mature in very preterm
Okay.
babies.
Okay. Then another question again. I heard you said in an apnea of the preterm that we can still use bubble CPAP for patients having apnea. But in my facility, once the baby started having apnea, we don't put the patient on CPAP until when the breathing pattern stabilize. So
Mhm.
is it how what you mean? Or when we stabilize, we still go back to CPAP immediately?
Yeah, so with apnea of prematurity, I'm not talking like if a patient is in the middle of an apneic episode, that's not when you start CPAP. But for example, if a baby has apneic episodes and you rule everything out and you settle on the diagnosis of apnea of prematurity, the steps are usually you give caffeine, you give them support as much as possible. If that isn't helping, you can give CPAP to kind of support. But this is only for apnea of prematurity, not episodes of apnea in general. So
Okay,
you don't give CPAP when a baby is in apnea, but if you give them the diagnosis of apnea of prematurity, which I know is a diagnosis of exclusion, when you reach this diagnosis, you can help give CPAP can help kind of facilitate
okay.
their growth.
So thank you very much.
Thank you.
Okay, I will.
Hello, good evening. Thank
Hello.
you for the training.
Hi, good evening.
Please, I want to ask a question. Most times, when you connect this CPAP to a baby, the SpO2 drops. But normally, the child's SpO2 maybe will be within 80 to 85, and you decide to connect your CPAP. When you now connect, you see that the SpO2 drops to 70, 75. At this point now, what do you do? At what FiO2 are you meant to keep it?
Thank you. I think this is beyond my expertise because I'm not a neonatologist, and I know these things it's best to follow clinical judgment and any guidelines you may have. Uh, yeah, I don't think I can give you a specific answer of like when the saturation is this, what do you do and what settings to put. I'm sorry. If anyone else wants to weigh in, please feel free to go ahead.
Please, can you take that question again, please, for clarity? Thank you.
I said there, for instance, there is a baby, um, maybe less than 30, a preterm, less than 37. The baby's normal breathing on his or her own, SpO2 is within 80 to 85, and you decided to connect the CPAP. By the time you connect the CPAP and you see that the SpO2 drops to 60, 65, 70. At this point now, at what level will you set the FiO2?
All right, thank you very much. Setting your FiO2, it does not have, or how the best way to say is that where you set your FiO2 on is actually not cast in stone. What we recommend and what we do generally is that we ask you to connect your patient to a very good multi-parameter monitor that can give you the SpO2 readout on the patient, as fast as possible. And then you begin to adjust. So for a patient that already has about 86, you don't need to do too much. So it will be best to start at the base. So for the Vayu bubble CPAP, the least FiO2 you can select is 30. So we would recommend you start at 30 and then you monitor your SpO2 feedback from the patient closely. So if it is stable and has improved to about 96 or 98, while you are at an FiO2 of 30, that's a huge achievement. And then you are advised to remain there. But what is most important is also setting your bubble pressure generator correctly, because this pressure actually plays a role in helping to recruit alveoli. The alveoli is a site for gas exchange. So for CPAP to be effective, it's not just about setting the correct FiO2, but it's also important that we set the bubble pressure correctly so that we can recruit alveoli and have optimal gas exchange in the lungs. Thank you.
Thank you.
Please, do we have more questions?
Thank you very much for the presentation. Please, will it be possible to have maybe the slides for us to refresh our memories after? Can it be sent to our emails?
Yes, absolutely. I have sent a phone number. It will also be projected now. So just send us a DM on WhatsApp with your email, and before Monday, before close of business on Monday, we should send the slide to all of you. So the number will be displayed on the screen right now, and it has also been sent to the chat box of this meeting. You can reach out to us via that WhatsApp number. Send us a DM with your email address, and we will send it to you. Thank you very much.
Good evening. Good evening. My name is Esther. Thank you so much for the presentation. Please, I have a question. I want to know, is there any recommended liter of oxygen that should be given when using this CPAP? I mean, from the source of oxygen, the main source of oxygen. Is there any recommended liter that we can use?
Jana, do you want to answer this?
Hello, thank you for your question. I think the same as I answered with the oxygen concentration, this isn't something we tend to give recommendations on because it's based off of your clinical judgment. But the best thing is you want to make sure that you're giving adequate flow so that the system is bubbling. So if you don't see any bubbling in your system, I recommend increasing your flow. First, making sure there are no leaks or anything's blocked off. And then if there's still no bubbling, just increasing your flow until you have bubbling in your system. And that means you're giving appropriate and adequate flow. But I don't have any recommendations in terms of specific numbers.
All right, thank you.
Thank you. Thank you very much, Jana. So again, to add to what Jana has said, clinically from the trainings that we conduct to our customers across different facilities in Nigeria, what we recommend and what we see them use most of the time as flow rate is between 2 to 3 liters per minute. 2 to 3 liters per minute usually work for most of our customers across the different facilities that we have sold devices to. But again, I would also like to add this. Sometimes we get calls from customers saying that this Vayu Bubble CPAP device is not bubbling. So for those of you who already own this device, please pay key attention. For those of you who already own the Vayu CPAP
What of your
device,
neighbor?
please pay keen attention.
Huh? Huh? Go go. Hey.
Please mute your microphone. Please mute your microphone. Thank you very much. So to add to what Jana has said, So to add to what Jana has said, from the trainings that we have been conducting for customers across different cities in Nigeria, what we recommend and what they actually utilize clinically is between 2 to 3 liters per minute of oxygen flow, either from the cylinder, from the wall source, or from the oxygen concentrator. However, there's an important message I need to pass across, especially for those who already own the Vayu Bubble CPAP device. Now, most times we get calls from customers saying that the CPAP device is not bubbling. Now, it's a pressure-driven system. So if you have low flow and low pressure from your oxygen source, there is a high possibility that your system will not bubble. So what we find people do is that, for example, if they are connecting oxygen from a cylinder, they would connect it through a humidifier. Now, we all know this humidifier that I'm talking about, the one we use in giving supplemental oxygen, the direct oxygen to patients. No, you do not connect the Vayu CPAP device to the humidifier that is attached to your oxygen cylinder. Rather, detach the humidifier and connect the Vayu CPAP device directly to the oxygen bottle. Then do same for your oxygen concentrator. Don't connect the Vayu CPAP device to the humidifier in your concentrator. Connect it directly to the outlet of your concentrator or to the outlet of your oxygen cylinder. This is the only way you can be rest assured of getting the optimal pressure that is coming from the cylinder or the concentrator, as the case may be, that will drive your system efficiently and effectively. If you connect through those humidifier, it will drop the pressure and you will not get that high pressure to drive your system and cause it to bubble. So I hope this is clear for those who already have the CPAP device, the Vayu CPAP device, and of course, those who do not have and are yet to buy should also take note of this, so that when they get their device, they will be able to know how to connect and set the right amount of flow rates, either from the oxygen source, from the cylinder, or from the concentrator. Thank you very much.
Okay, thank you so much. But I have another question. What if the humidifier is kept empty?
Yes, if the humidifier is kept empty, it still does not make any difference. You are still going to have a reduction in pressure. Now, I needed to do a little experiment after this webinar. Now, open your cylinder without the humidifier and then feel the flow rate, like the pressure with which the air is going to come out. The humidifier is designed in such a way that it lowers the pressure to such an extent that the patient can tolerate. Because for that humidifier, the original design is for you to, humidify the oxygen that you give to your patient directly. So it drops the pressure that is coming from the cylinder and then to a tolerable pressure that your patient can support. So if you feed that same patient pressure to your machine, it is not going to be able to drive it. So clearly, the humidifier is designed to drop the pressure. So whether there is water in it or not, it still does not make any difference. It still drops the pressure. So it is best you connect directly. That's the only way you can get the best pressure out of your cylinder. Thank you. So do we have any more questions?
We have
Okay,
some
so
question on the chat box.
okay, so
How
Philip,
much?
please can you read out some of the questions from Doctor, please go ahead with your question.
How much is the Vayu CPAP currently?
So it's currently 900,000 naira. 900,000 naira currently.
Okay, thank you, sir.
Thank you. Then there's also something I would like to mention. For those of us that have the Vayu CPAP already, or those of us who are intending to buy, it's important I put this out there. The CPAP device comes with disposable filters. So one thing I have noticed in most practices, I was in Port Harcourt a couple of days ago, and I saw a situation where the filter became very dark and then highly discolored and all of that, suggesting that there is so much dust in it. Now, the standard recommendation is for you to replace the filter disc every day. So if you have a patient on CPAP for, let's say, 7 days or 6 days, the recommendation is that you change the filter every single day. So if you observe, your box of the CPAP device comes with lots and lots of filters that will take you for, you know, maybe months, as the case may be. But however, if you run out of filters, you can always reach out to us, and we are more than happy to sell filters to you at a highly reduced price. So please, it's important for us to change the filters, on the CPAP device every single day. It is important. One filter every day, even if it's the same patient. Thank you so much. So, Philip, can you take a few questions from the chat box quickly so that
All
we
right,
wrap
sir.
up?
So,
Thank you.
okay, one of the questions is that is it the oxygen levels that determines the bubble or the exhale air?
Jana, did you get that question?
Yes, that's a good question. So you're asking if it's the oxygen concentration that determines the bubbling and the pressure?
The oxygen flow rate, is it the oxygen flow rate that determines the bubble or the exhale air from the patient?
It is the oxygen flow rate that determines the bubbling. So the higher up you go on your oxygen flow rate, the more bubbling you will have, and vice versa. When it comes to what determines the pressure you're giving the lungs, so I didn't go into much depth because this is something we talk more about in our trainings. So in the pressure generator, you have a wand that goes into the pressure generator jar, and the deeper the wand is, the more pressure you're delivering to the baby's lungs. But when it comes to the bubbling, that's determined by the flow rate that you're giving your patient.
All right. Thank you very much,
Thank you.
Jana. Yeah, quickly, let me also remind our audience that apart from the Vayu Cpap device itself, we also have the Vayu Oxygen Blender. So the whole essence of the Vayu Oxygen Blender is to make sure that we don't give 100% oxygen concentration to babies, because we have talked about, how harmful and dangerous this can be. So that is why we have the Vayu Oxygen Blender. So currently, we are running the Vayu Oxygen Blender is selling at a discounted price of 180,000 naira for 1 unit. So the Vayu Oxygen Blenders are available for a discounted rate of 180,000 naira. So you can send us a DM, and we would tell you how you can get these devices from us. The Vayu Oxygen Blender. It is not good to give 100% oxygen concentration to patients. Retinopathy of prematurity and brain damage and a host of other not so nice implications can arise when we give 100% concentrated oxygen to patients. So diluting and blending is important. So that's why it is good for you to also get the Vayu Oxygen Blender, as well as the Vayu Cpap device itself. Thank you very much. Philip, let's take more questions.
Okay. The next question is, how often should the water on the jars be changed? Do you get that?
Yes, Jana, please go ahead.
Yes. Thank you for your question. And again, this is these details we go over in more depth in our trainings. But so you have two jars. You have the humidifier jar and you have the pressure generator jar. And there are lines on the jar that you want to make sure that the water is filled to those lines at all time. So every 6 hours or so, we recommend filling up the jars. As for completely exchanging the water in the jars, that happens every 24 hours. So every 24 hours, you have to completely remove the water in your jars, put in new water. So exchanging the water.
Okay. So
All
I
right,
think we
thank you
should
very
take
much.
one more question.
Okay, go ahead.
So the next question is, should we give the CPAP when the baby is in extreme difficulty breathing, like severe chest, ingrowing, or gasping?
It's important to use your clinical judgment for these. So if it's moderate respiratory distress to severe, CPAP is an option. But if you feel like the patient is in very severe respiratory distress, you might have to use a higher modality of respiratory support, such as like intubation, mechanical ventilation. At the end of the day, it comes down to clinical judgment.
Okay, ma. Thank you very much. I want to use this opportunity to thank everybody that take out of their busy schedule to attend this webinar. I also want to thank Dr. Jana for her time and her talent and everything, and everybody that participated in this webinar all around the 36 states in Nigeria. We want to say a big thank you. Also, once again, this great webinar program, free of charge, is being presented and sponsored by Fatra Medical Equipment Services. Patra Medical Equipment Services is a biomedical equipment company in Nigeria that supply, sell, and offer other medical equipment services to all medical facilities across Nigeria. Should you need any of our services, like the purchase of the Vayu Cpap, or you want us to come again and do free demo or to speak to your management in order for them to acquire the Vayu Cpap or the Vayu blender in your facility, feel free to reach out to us. We have our number displayed on the screen so that we can come and attend to you. Thank you very much. And the slides will be sent to your number to you. Just send us a DM through this number on the screen. I want to say a big thank you to everyone. Thank you very much and have a blessed day. Thank you.
Thank
Thank
you,
you.
everyone. Thank you, Jana. Thank you.
Thank you for organizing this, and thank you everyone for joining. Have a nice rest of your day. Bye.
Bye bye. Thank you.
Bye.
Papa, you see that the SPO2 drops 60, 65, 7 volts. And now, at what